All right, so thanks for having us, everybody. So before I begin, I want to preface this talk by saying that we're an unconventional group by all terms of the word. We're biology and nursing majors. We have absolutely no experience in manufacturing or business. It's something that I hope will help us rather than hurt us going forward. But we are Know Your Narcan, and we're also unconventional in that we want to implement a proven, already made solution to a very real problem. We haven't invented anything. For lack of a better term, we're not smart enough to. But with that being said, throughout the United States, opioid drug abuse, painkillers, and heroin in particular, is on the rise, especially in the state of Massachusetts. A 2013 study by the Massachusetts Department of Health indicated that Middlesex County in particular has the highest opioid-related death rate in the state. In the Middlesex County, in fact, between the years 2012 and 2014, the drug-related deaths has doubled, and it's only expected to rise in the following years. Narcan, or naloxone, is a drug approved for use by the general public and healthcare providers at all levels. A simple vial like this, sprayed up the nose, just like that, is enough to stop respiratory arrest and stimulate the nervous system to jumpstart vital organ systems, which is the main cause of death in opioid overdoses. So as you can see, the solution to this problem already exists. Throughout the state, Narcan education and support groups help addicts not only learn to use and obtain this life-saving medication, but we've now identified a new problem, and that's the rising use and abuse of opioids in young adults, people under the age of 25 years like us. Our solution is to have healthcare providers at the front lines of overdoses, nurses and emergency department physicians, identify young adults at risk, those hospitalized for opioid overdoses, who might benefit from this program. We then can use already existing support systems to develop curriculum geared towards family, friends, and loved ones of opioid addicts under the age of 25 years old in the Middlesex County. Know Your Narcan offers a valuable solution to a very real problem affecting communities at a wide range of levels, from government organizations to emergency personnel to addicts and loved ones. With your help, we hope to use Know Your Narcan to educate, distribute, and revitalize the Merrimack Valley. And here's how we're going to do it.
So we have an estimated budget of $2,500. This will cover the cost of 2 classes. Having each person receive a Narcan kit upon dismissal of the class, as well as printed educational materials in the class, we have estimated that each person would cost around $31 per session. $30 is for the Narcan kit, and $1 approximately is for the printed materials. Without knowing a location for the class, we are unable to estimate that price, but we just allotted $1,000 for that. In order to make the class known to the public and the people in the communities, we would need to have advertisement. With research on social media advertising, it is evident that we can make this project known on Facebook for approximately $15. Knowing that not all people are on such websites, we have allotted approximately $50 for printed materials that would include information on the course that we can put up throughout the communities and let those who aren't on social media know of the project. We have estimated the price of having 20 members in the class. So with 20 Narcan kits and printed educational materials for each person, that would come out to $620 per class. This, however, does not include advertisement fees or location price, since we aren't sure of the location yet. The numbers shown here make it evident that this project is affordable and well worth your investment. So again, with your help, $31 is all it takes to help save a life. We once again would like to thank you for your time and would offer this time for any questions if you have them.
Is the Narcan, you call it,
Yep.
is that a regulated medical product or drug, or?
Hi, my name is Patrick Kiley. I'm a nationally registered EMT and EMT in the state of Massachusetts. Narcan is a regulated drug. However, as of right now, there are doctors in Boston and in surrounding communities that have put up a standing order for pharmacies as well as organizations like us to be able to give out Narcan to people who have family members that are at risk. And these are standing orders that the Narcan can be delivered by anyone from an EMT basic all the way up through a doctor.
So with that being said, anyone in this room could walk into a CVS or a Walgreens, and provided they get training from the pharmacist, can go home with Narcan.
With no prescription.
Correct.
Okay. Thank you.
So who's going to actually conduct the classes?
Sure. So, do you want to answer that?
Well, having an EMT currently and 3 of us being nursing majors, we are able to administer that within the hospital. So we feel that we would at least have the information and the education to be able to distribute that to people. I know for the nursing majors, excluding him since the 4 of us are nursing and he's bio, in the hospital we give education on everything, on how to do certain treatments, how to take your medications, and when patients leave the hospital, we're in charge of giving them the education. So we could be responsible for giving education of the Narcan or naloxone to these people.
Legally.
Yeah,
Correct.
in terms of liability, which is a question that has come up several times, I've been in talks with the Massachusetts State Police as well as UMass Police and Lowell Police, and all that they are worried about is getting that medical order from a doctor, and we have a doctor at Lowell General who is willing to give this standing order for us to legally train people and teach them how to use it.
So if the doctor gives the order,
Yep, that's
you
all.
don't have to take a class on being able to teach people how to do this? You don't have to have any kind of certification to be able to teach people how to do this?
Not necessarily, no. The being at an EMT basic level is enough, and having nursing students that are above 2 years of nursing school also meets qualifications to do that.
As it stands now, it's such a new program that you currently do not need to be trained to educate. Right. Because actually the really awesome thing about Narcan, and I don't mean to cut people off for questions, but it actually has very little contraindications, meaning it can't do very much harm, which is why I could spray it and everyone's fine.
So even if someone isn't having an overdose and you injected them, it won't harm them further. So
So have you explored the possibility of any grant money? Because this sounds like something that, typically might have some grant at the federal or state level versus, necessarily coming to us for funds. And obviously this is a volunteer program. Just any thoughts about pursuing grant type money or funding?
We haven't looked into that yet. I'll say that. I know that this, the problem of Narcan or of heroin opiate use is fairly new. Just in between 2013 and 2015, 2013 they have reported 80 deaths in Middlesex County from heroin overdose. From January up until now, for Middlesex County, we have already had 54 deaths. So this has been such an expansive, growing problem that there really isn't a lot of money, a lot of grants that have been set up to do this kind of training as of right now.
Are you targeting friends and family of these people, or are you targeting the actual abusers?
So the friends and family would be our prime audience. These are the people that are going to potentially walk in on a family member or a friend that's going to be overdosed. And the aim of this would be to educate them on the signs and symptoms of the overdose and then how to appropriately respond to that.
You indicated that there are other organizations that do this. Are there other organizations within the Merrimack Valley?
Sure.
And so have you spoken with them, and how does your work link up with their work?
So we actually communicated with the Lowell Community Health Center, and we discussed with them how they approach their teaching of it. And he does one-on-one teaching as well as going to group sessions. But when we talked to him about his group sessions, it seemed that he went to more addiction centers and aimed it more at the people who are addicted versus the family and friends, which is what we want to focus on. And that was more in the Lowell community. So we wanted to aim it more at suburban areas that do still have the problem but are lacking resources.
Right.
Upon our research, within the Middlesex County with like Drayton and Tingsboro, Chelmsford, areas that still do have a problem, they don't have resources to help. And although they are close to Lowell, it would be more convenient for them if we were giving them right in their community.
What about the Narcotics Anonymous group? How did they kind of weave into this? 'Cause I'm just thinking that it's hard to get people to say, yes, in
Right.
fact, I have
Right.
an addict in my family, and then to go to a public place and learn about Narcan. So, you know, really tapping into them where they already kind of exist, going to a Narcotics Anonymous group and maybe doing a presentation there. And then you've got the group,
Yeah.
if you will,
Sure.
and you've got the location, you're not paying for the location at that point. Have you thought about reaching out to that group?
So I'm different in that I'm the scientist of the group, and they'll tell you I love data. I'm a really weird college kid in that I love just sifting through studies and things like that. And what I found going through the Department of Health study is that you can actually, they show you people who have been, or not people, but the numbers of people who have been hospitalized for opioid overdoses and related incidences like that. And actually what we found is that a majority of the places where a majority of those hospitalized for that, where the age is under 25 years old, are from high-income suburbs, which is really, really scary. So those are places like Drake, North Andover, Chelmsford, which isn't the first thing that you think of when you go, okay, heroin overdoses. And so I think part of the reason is that not only is as you were saying, it's difficult to get a topic like this discussed, especially at a young age in areas like that, but also there's been studies looking into the fact that areas of higher income, students and younger individuals have more of a disposable income where they're going to be able to afford drugs that have a higher street value, like heroin, as opposed to lower risk substances. So I think that targeting these suburban areas would be an even better way of getting those families in, because if you were to come, so I've personally been affected by opioid overdoses coming from Drake, which is really weird, again, because it's that suburb. And if you were to talk to the parents of one of my friends who had passed away from an opioid overdose and ask them to go seek help at a Narcotics Anonymous group in Lowell, they would almost become defensive. And so I think our program is different in that we target those suburban areas.
I'm still not sure how people are going to come out to it.
Sure.
You know?
Well,
Yeah.
right, and so that would be part of one of the challenges, developing a curriculum where you could help healthcare providers discuss this with their families, because the idea is that for individuals under the age of 25, they're going to be accompanied at the hospital by either a family, a friend, or a loved one. Whether or not that's mom and dad running in, or if it's one of their friends, I think that one of those friends would be more apt to go to one of these things to say, okay, if I ever encountered my friend like this, this is a very simple class that I could go to, and it's a very simple way of potentially saving my friend's life.
So are you envisioning having the hospitals have like a brochure or a flyer about
Correct.
your program to give
That's-
out and just say, you know, some added information,
Absolutely.
resources?
Mhm.
Especially for this area, we're targeting, you know, the greater Lowell area, Merrimack Valley, Middlesex County. A lot of these patients are coming to Lowell General Hospital, Saints campus, where we have doctors that we've talked to that are willing to go along with this program. They're willing to give the standing order, and they're willing to, you know, provide help. They want to get these patients so that they're not coming back to the hospital.
Sure.
And that's the goal of this program. We want to, you know, there's one detox center for opiate overdose in Middlesex County. It's Tewksbury State Hospital. They have 32 beds. There's 1.5 million people in Middlesex County. You know, and you're talking already this year, 54 people have overdosed. There's only 32 beds in that facility.
Very scary.
So we need something too that, you know, maybe we can't get these people to stop taking opiates right away, but at least to prevent death
Right,
is
them
the
alive.
main
Right.
goal.
Have you thought about sustainability of the program once you guys all move on and graduate and?
Sure.
Just ask a question.
Right. Pat and I can tell you, so I was also an EMT. My certification just expired 2 days ago because I'm seeking graduate school. I don't want patients anymore. But with that being said, we have a very forward-thinking emergency medical service where I'd be willing to bet that the people in that program and the leadership office of that program would even be willing to continue this program if we cannot find you know, a little proteges ourselves. They would absolutely love that.
Thank you very much.
Thank you so
Thank you
much.
very much.
Bye.
Good luck.
Thanks.